Earlier studies have shown twofold increased risk of cardiovascular disease in patients with rheumatoid arthritis as compared to the general population. Recent studies from the United States, Canada, and from Europe have shown that mortality in patients with cardiovascular mortality in patients with rheumatoid arthritis is improving in 2000s as compared to the previous decades. With this study, we aimed to look at cardiovascular disease incidence in across 3 decades, 1980s, 1990s, and 2000s, and comparing it with non-RA population, general population of Olmsted County, Minnesota. So we did a retrospective cohort study enumerating patients from Olmsted County, Minnesota who have rheumatoid arthritis and ascertaining cardiovascular disease in this cohort and comparing this cohort to non-RA population, age and sex matched comparators. We looked at cardiovascular disease events such as myocardial infarction and stroke, as well as death from coronary heart disease. The decades we analyzed were 1980s, 1990s, and 2000s. This would be when RA criteria were met for 1987 criteria were met for particular RA subject. So this is an incident cohort of RA patients diagnosed during 1980s, 1990s, and 2000s, and similarly matched non-RA comparators on age, sex, and index date. We followed up our population through 2016, through December of 2016. What we found is that cumulative incidence of cardiovascular disease, any event, was much lower in patients with rheumatoid arthritis diagnosed in 2000s as compared to 1980s and 1990s. The gap in the excess risk of cardiovascular disease in patients with rheumatoid arthritis as compared to general population appears to also be diminishing in this most recent cohort in 2000s. We observed almost half risk of cardiovascular disease in patients with rheumatoid arthritis diagnosed in 2000s as compared to 1980s, and then no excess risk as compared to non-RA population in this same 2000 decade. So overall, the impression is that cardiovascular morbidity is improving. The incidence of cardiovascular disease is declining in patients with rheumatoid arthritis over time, and as compared to non-RA population. This is a very encouraging trend, and certainly several factors can be contributing from this observational study. We wouldn't be able to say what exactly drove this was driving these associations, these trends, but improvement in treatment of rheumatoid arthritis with a trick-to-target approach and use of biologics may have influenced these trends, as well as improvement in optimization management of preventative cardiovascular health and management of cardiovascular disease risk, with increased awareness of that over the previous decade.